Okay, let's talk about tongue ties, something very close to my heart. My son was tongue tied. We had him done at I think 6 or 8 weeks. I wasn't. I'm tongue tied, but I haven't had mine done. Give me your thoughts on like why does the tongue tie even present? Is there because and again this is way too simplified, but people talk about the evolutionary benefits. Mother Nature doesn't waste anything. But so what would be even the point of there being a tongue tie, or is it like a misfire in nature? So just give us your thoughts if you can first of all on why are there tongue ties, and are we seeing more tongue ties, or are they being more identified? So yeah, just give me an overall holistic view of tongue ties if you could first.
Yeah, well, tongue tie is thought to be a failure of apoptosis or programmed cell death. So normally the cells would resorb away before birth, but somehow that's not happening. And I'm really not 100% sure as to why that is the case. Is there an increased incidence? I'm not 100% sure either. Because a lot of the research that's done on tongue tie, they're only looking for anterior tongue tie, or the tongue tie that is restricting all the way to the tip of the tongue. But now we know that even those more hidden ones, or sometimes they're called posterior tongue tie, they impact the elevation of the mid-tongue, which is so important for sucking, swallowing, and breathing, and good palate development. And so there's a lot more awareness of that now. And so we're definitely starting to recognize that a lot more. And I'm seeing, older patients, adults, and it's been very underdiagnosed. So it could be that we're just a lot more aware of it now that we understand the implications and how it can affect so many other functions beyond breastfeeding.
And what are those other functions? So let's say we've gone past the breastfeeding phase and we've still got the tongue tie. What are those other challenges that present later?
Well, even in babies, if you have a tongue tie and then you get around it by going onto a bottle, whether you're on the breast or bottle, we need it for good swallowing. We need the good tongue elevation. And sometimes if we have a tongue tie, we can actually swallow a lot of air as a baby. So I see that a lot in babies where they're sucking a lot of air, they're making a lot of noise, clicking on the bottle, and that can be linked to reflux-like symptoms, or sometimes called aerophagia, where children may be really unsettled and difficult to put down, stiff and arching, pulling on and off the bottle, and throwing up, vomiting, very gassy. It can create a lot of misery for these babies and for parents as well, because sometimes babies are put on reflux medications and they're not particularly well proven or studied, and the symptoms don't go away. But sometimes we got to check if we're going to medicate a baby, or if they have reflux symptoms or colic symptoms, check that they're not swallowing air. Because if that tongue can't lift properly, we're not going to swallow well. And that's when we get more air introduced as well. So what else do we need? We need our tongue for swallowing solids as well, and manipulating our food. So maybe in the toddler age group, we might see children that are struggling more with their solids or choking or gagging. We also know that there is research to suggest that the tongue up is really important to stimulate palate receptors, and it's really important for speech perception as well. So there's a sensory motor component where we need the tongue up to perceive sounds. And so if the tongue is not up, that may be implicated in speech delay, whether it's a tongue tie or whether it's a pacifier. So that's really important, as well as speech. For speech articulation, we need good tongue elevation. Otherwise, we may have more lisp and mispronunciations. And so what I see is a lot of babies, or children, that have been in speech therapy for 3 years and they're really not getting ahead. So we need to make sure that the tongue can elevate correctly. And I actually see a lot of children that have tongue tie that can speak perfectly clearly. You can really understand them. But when I watch their mouth, because I take a lot of videos, you can actually see that they make their speech sounds with their lips and their cheeks, and they're using other muscles they shouldn't. Now, the problem with all these compensations, when we use muscles that we shouldn't, whether it be muscles of our neck or jaw or our face, is that we don't develop good tongue tone. And why do we need really good tongue tone? Because we need good tongue to palate suction during sleep. When all the muscles are really relaxed, we want that tongue functioning well. during childhood to develop their palate. But also the tongue, the bulk of the tongue is formed by the genioglossus muscle, which is the main upper airway dilator muscle. It keeps the throat open. So it needs to work well, and it will play out during sleep eventually down the track if it's not working well, when all our muscles are more relaxed. When that tongue is not sitting up and it's more down, that base of the tongue, it becomes very flaccid. And it's the base of the tongue that is more prone to obstructing the throat during sleep. And so, there is a lot of evidence now, or quite a few papers now, to link tongue tie to the development of obstructive sleep apnea. But we have to remember obstructive sleep apnea is a very end-stage problem, and it may not present till much later on in life. And so one of the earlier clues that can happen is a lot of teeth grinding, or it's kind of like a protective mechanism. So when we're young, we have a fight or flight response, a sympathetic nervous response that's really intact. And so anytime there is a narrowing of our airway, we have an arousal from sleep, from deep to lighter sleep, and like grinding to recruit the jaw muscles and to keep the airway open. So there's a lot of issues that can be associated with a tongue tie. But a lot of the time they get dismissed or missed because we compensate. We can use other muscles, and we can give babies bottles or give them shields. We can do this speech therapy. We can do a lot of things, but we also introduce these compensations that don't allow the tongue to do its most important jobs during breathing and jaw development.
Wow. So this is where I really want to talk about adult tongue tie now, and the relevance to me. So I watched my son's tongue tie happen, and it was so elegant. We had the consultation. I was a bit scared, so we went away for a few weeks. My wife suffered with breastfeeding. We should have had it done there and then. We went back. It was very quick. Went on the boob afterwards, a little bit of blood, and I was like, "Wow, that was." And I know they're not all like that. And he's got wonderful movement now. So I think I'm all the way to the front. My tongue tie. I had speech therapy. Had ADHD, and there's some other things that you've just said about compensation. I thought, oh well, because I couldn't say blue, so I had to learn to say blue in a different way because of the way the tongue is. And I have a lot of forward posture problems and a lot of tightness in the jaw. So I'd love to hear your thoughts on, should a man in his 40s consider getting that snipped? Because what scares me, and I've not looked at, I've had one consultation, is you might have to learn to talk again. There could be a lot of blood. You have to be under general anaesthetic, which I've never had done before. So could you talk a bit about adult tongue tie release, and what are some of the problems that people like me might have because we've got that tongue tie?
Yeah, definitely. So that when I see adults with tongue tie, there's two main presentations. The first is in relation to posture, body posture, and chronic neck tension and headaches. And the second is related to breathing, mouth breathing, and sleep issues. So how is a tongue tie related to headaches? Well, the tongue is really connected to the rest of the body through a connective tissue called fascia. It envelopes all the tissues in our body so that we can, have things moving all at the same time. But there's a deep line fascia that goes from the base of the tongue all the way down to our toes. And so if one bit, it's kind of like a stocking. So if one bit is tight, it actually affects or restricts the mobility in distant structures as well. And so I think with the hunchness, that can be very much related to the tight fascia from the tongue tie. But what I see a lot of is people that they can't lift their tongue. And so to lift their tongue, they actually have to use muscles of their neck. And so this actually can create trigger points inside the neck, which can lead to referred pain or headaches or even migraine-like symptoms. So for them patients, yes, I do believe that for a good amount of them, tongue tie release can be helpful. But there's a few other things that we need to take into consideration as well. And then the other symptom is really going to be the clenching, grinding, mouth breathing, those type of symptoms, and problems with unrefreshed sleep as well. And so in principle, whenever I have an adult, the first thing that I want to do to make sure that we're going to get a good outcome is make sure we have enough tongue space. We want to make sure that the palate is sufficiently wide enough to house the tongue, because a lot of the time there may be a very restricted or constricted tongue space. And so if we don't have a good tongue space, where is that tongue going to go? It may be more likely to obstruct the breathing and aggravate breathing problems. So we want to assess that there is enough tongue space, and if not, sometimes people will benefit from adult palate expansion to make that space, and that can also increase breathing improvements as well. And then when we do tongue tie release, the ultimate goal is really to get that tongue lightly suctioned to the roof of the mouth at rest. And to do that, we often will need to do a lot of myofunctional therapy to actually retrain where should the tongue sit, how should the tongue move to really restore some normal tone in the tongue. And so that's done through exercises and practice at home, and that myofunctional therapy helps to prepare for the tongue tie release so that we can establish what is actually restrictive and what is actually not just too weak and not knowing how to move. And then post-release, it just helps to keep the movement. It's really good training, and then we can actually ensure that the back of the tongue is working well as well. And so when you ask about the speech, will it impact your speech? If you're doing myofunctional therapy and you've retrained your tongue and improved the tone and coordination of that tongue, it should really only be a temporary thing. It should actually maybe even make it less effortful to articulate. And, you know, a lot of adults, they might say after a long day, it's really hard, they slur, it's difficult. So those type of symptoms should improve. Should it be, is there bleeding? Well, not really. A lot of people will use lasers, which can actually help to control the bleeding. But even for an adult compared to a baby, using traditional techniques with scissors, artery forceps, we should be able to manage the bleeding fairly well anyway. And what else did you ask? Should it be done under general anesthetic? No, not generally. I would usually do it in the chair.
Okay, oh, that's really exciting. Yeah, I've heard about these lasers. I've not seen these videos, but somebody's told me that maybe you've seen or you've experienced this yourself. Some adult patients will have it done, and they'll be like, "Oh my God, I can feel some space back here again." Have you come across this?
Yeah, it's interesting. Not every patient, but definitely because there's a restriction that's been there for so long. And that's why I really like to work with body work, be it osteo or chiropractic treatment, to work in combination to prepare the body pre and post-release to get everything moving well as well. And yes, even from babies that have really tight restrictions or head turn preferences, and they've had a lot of chiro work and then the results plateau, the tongue tie release can be a missing link to actually improve the mobility. And so I've had a lot of adults report this. It's almost like a literal release of a person. It's just this release of tension. So that's really always amazing to be a part of. But even young children as well. I take a lot of photos pre and post release of people moving their head, neck, flex neck extension, and turning their heads. And even children, they can perceive the difference as well. Oh, it's easier to do this. It's easier to do this. Or some people can't touch their toes, and then post-release they can touch their toes further. So yeah, it really can help to unwind the body. Results are very variable, so it's important to work with a team approach.
That's really exciting.